the poll posted. We can do a round of introductions, and I'll start with myself. I'm your official in front of the scenes moderator today. Zach's behind the scenes there for troubleshooting. I'm Tonya Saffer. I am the Vice President of Government Affairs and Market Access for Outset Medical, the manufacturer of Tablo home hemodialysis system. And I have actually been in the kidney care space for about 16 years now. I've been in various roles, and I really consider myself primarily, first and foremost, a patient advocate. And I'm so happy to be moderating this session about advocacy. I'll feel right at home. We'll do this very informally, just comfortable chat from the group here. Ask your questions. I mean, this is really an empowerment group here, for sure. We're all about empowering patients. And so you can ask your questions. I know we're going to get a lot of really great advice during this session from our experts. The other thing I will mention that I forgot to put in my introduction is I'm also proud to be a board member with my fellow here, Don Edwards of Home Dialyzers United, who's been putting on this fabulous event. And I've loved it. I've been participating in the various sessions, as many of you have. And so it's been a really great time. So with that, I want to introduce our panelists. And the first one is Lisa Burgess. She has been an advocate for medically complex patients since the mid-1980s after the birth of her middle son, Jamie. And she'll talk a little bit more about Jamie today. Lisa is a family advisor emeritus to Boston Children's Hospital and an author with nearly 4 decades of experiential knowledge with this unique population as both an advocate and now as a home hemodialysis care partner. I'm also joined by the fabulous, love her glasses, Renee E Bova-Collis. I hope I said that correctly. I should have practiced better.
It's fine.
The patient engagement specialist for Quality Insights Renal Network 5, which covers Maryland, Virginia, West Virginia, and the District of Columbia. In her 16 years with the network, she has been primarily responsible for promoting patient involvement in care and handling patient grievances, as well as providing education, resources, and supportive services to the renal community. Renee also has 13 years of experience as a dialysis social worker and is the proud recipient of the 2019 AAKP Medal of Excellence Award. And Dawn Edwards is a self-described chronic kidney disease warrior. She has firsthand experience of every renal replacement modality, including kidney transplant and rejection. Dawn is a dedicated patient advocate with a plethora of insights into the needs of people with CKD. She is also a resource to her community, sharing her story and educating people about the relationships between hypertension, diabetes, and kidney disease, especially in underserved communities. So welcome to you all. Really happy to have your expertise on the panel today. I will note to the participants, the poll is up. It would be really great if you could take that poll for me. Let us know who's here in the audience today. I have no idea how to see the results, but Zach will probably get them to me. And hopefully we can have a good understanding of our audience here as we go along. And with that, I'm going to go ahead and please put your questions that you have about advocacy and how to be an advocate for yourself, how to be an advocate for your care partner or loved one, and how to be an advocate to change policy to better meet those, your needs and those of your loved ones. With that, I'm going to go ahead and pose a couple of, just going to share a couple of observations and why advocacy is so important. And then I will pose the first question. The first, just some observations from today. I think we've heard from a lot of really great speakers. I was attending this session this morning on making home dialysis work for you. And I thought it was really meaningful. There was just a little point within the session where, when you give patients choices and you see innovation and new technology and new providers come into the dialysis community, into the kidney care community, you start to see the environment more cater to patients' needs. as opposed to when I started in this space 16 years ago, it was very dictated by the provider, what the provider wanted, what was most convenient and easiest for the physician, and what they thought the patients should have and should do. Right? It was very, very dictated, I think, to the patients, and that has changed quite a bit, especially within the past couple of years, where you're starting to see providers, innovators, manufacturers compete for the patients, really design the experience, the systems around what the patient wants, what the patient needs. And I think that that's really exciting. And when you give patients more choices and more options, you tend to see them compete for those patients, right? And it's all more patient-centered that way. And so that's just kind of one of the things that I think was so unique. And in the session I participated in, what we saw as a perfect example of that is, the wonderful woman from Next Stage, who was a customer service specialist, was talking about, hey, how recently we know supplies are a challenge for storage and home dialysis, right? And patients have been, saying that for years, that one of the reasons they don't do home dialysis is they don't have enough room to store supplies, right? And that's also been an equity barrier, quite frankly, for people living in more low-income houses. And then recently, I guess Next Stage changed their policy and said, we're going to deliver supplies every 2 weeks or twice a month, instead of just once a month, to help patients manage their supplies better. Such a simple solution that just is more convenient for the patients, but certainly, and I can speak to this as somebody that works for a device manufacturer, more challenging logistically for the company. But you're seeing just small, meaningful changes like that starting to happen in this space, and it just speaks to why advocacy is so important. So with that, I do want to pose a question to this group, and I'm going to start with Dawn first, and just talk a little bit about your experience. I mean, you are an advocate in many different ways and shapes of the title and description there. Just tell us a little bit about your journey, why you decided to be an advocate, and how has it changed your life personally and the lives of others?
Absolutely. And that's a great question, because advocacy for me started with advocating for myself. I wasn't satisfied with my quality of life. I wasn't satisfied with the in-center dialysis experience, and I was about ready to give up completely. As a matter of fact, I had given up. I had withdrawn from dialysis, and I was introduced to home therapies. And when I experienced being at home and being in charge and being empowered, I said, wow, I wish I had known about this before. And I kind of flipped the script on my whole life. And I said, you know what? I want to get out there and give back. I want to talk to other patients. I want to talk to the people who are providing these dialysis services, and, let them know that, that we are important as patients, and our needs are important, and how important it is to not only let your physicians and the people who are caring for you, not only to let them know what's important to you physically, as far as your numbers and all of those things, but what's going on in your life and what's important to you there. And that's kind of where my advocacy began. So it started with advocating for myself and saying, hey, this life that I'm living is not acceptable, and speaking up for myself. But then it just began to spread. And now it's snowballed into an advocacy lifestyle that has me so busy speaking up and speaking out for patients that don't really have a voice or don't know what to say or what questions to ask. And I'm here to do it for them.
That's great. And I definitely see you on the speaking circuit. I think you are at almost every conference I have attended over the past several years in the kidney space. And so it's really wonderful to have you out there advocating on behalf of others. Lisa, same question to you. What led you to the advocacy space? What were you unsatisfied with? That's often how we get into advocacy. What sparked your interest in really engaging in this community?
Well, briefly, when my son was born, he was diagnosed with failure to thrive, and he was given a week to live. And we brought him home, and he was doing well compared to what they had told us. And long story short, he was diagnosed with a whole group of conditions, cardiac, renal, and lung. And we came into kidney disease just 3 years ago at the start of the pandemic is when he actually was diagnosed with kidney disease. But he's had an amazing quality of life. And that's come from asking a lot of questions and not being bashful. And we came into care in the 1980s when parents were told to sit down and be quiet. And I guess I didn't behave too well. So I learned to self-advocate very, very quickly and ask a lot of questions. And I started to learn. And in 1986, we were offered the home care pilot for complex medical children to come and be home with nursing, block time nursing. And it kind of evolved my advocacy from there. And during the pandemic, we have not had nursing. And the last 3 years, we, with my husband, have taken care of Jamie. And we did 15 months in center, but because of him having to be in the isolation unit with his immune system and needing open face oxygen, we decided that there had to be a different option. And his nephrologist said to me, I knew you'd be a good candidate for home hemo. And so the minute I graduated school last year, I started training, and we're home with the next stage. We've been home 15 months, just as long as we were in center, and I would never go back. I love being home and having a life and having him in his own space with his own movies. And it's enabled him to go fishing again and do all kinds of things that he wanted to do. His energy, everything has changed.
Thank you for sharing that. Lisa and Dawn, one more question for both of you, and then I want to give Renee an opportunity to kind of share how she advocates for patients as well, and what are some of the options that the network has to help patients. But first, you both mentioned knowing what key questions to ask, right? You had a lot of questions you started asking, basically, or to some degree disrupting the sit down, be quiet, do what I tell you mentality of dialysis, of kidney care of the past. And so what are, I think for some of the patients that are new and considering home dialysis as their option, and maybe just being exposed to it for the first time in this conference, what are some of those key questions that every patient should ask when they're first starting dialysis?
Well, for one of my things that I always like to tell patients is to, number one, ask questions about how do you take care of yourself? How can I prolong my kidney function if I still have kidney function? If I'm crashing into dialysis, what options do I have? What is it that I can do to empower myself over this disease and be in as much control and get as much of my life back as possible? You have to tell people what it is that you need. They say the squeaky wheel gets the oil. So you got to start squeaking. Yeah. You have to take things into your own hands, and you have to ask any question, even the ones that you think are stupid questions. And you have to ask for resources, because a lot of times you don't know what website to go to. You don't know what discussion group to go to. Sometimes you may get the wrong information. So you want to always check back. So you look in one thing, you get an answer from one place, but you also want to double check with someplace else. And one of the things that I found out early in my journey was that my ESRD network was right there, and they were completely unbiased. They had the information and the resources that I needed, and they helped to start me on my way. And they showed me what resources would be best for me.
That's great. Thank you, Dawn. And Lisa, same question to you. What are, as a care partner, what are some of the questions that other care partners should be asking as they're trying to best advocate and take care of their loved one?
I think when you come crashing into dialysis, you really don't know what to ask. And what I love to see is more guidance around that. And where I found that was HDU, Home Dialysis United, which I found online completely by accident. It was a Google suggestion that I joined this Facebook group. And I learned so much, because even though I had over 35 years in medical advocacy with multiple specialties in Boston hospitals, I did not know a lot about dialysis. This was all brand new to me. And I found answers, I found questions, and I also found a lot of videos and things, people that I could actually talk to. And I think that's really, really important. And when it gave me questions to go back to the physicians with, because like I said, we crashed into dialysis the first week of the pandemic. It was not a typical even crash into dialysis. So for us, having access to information and people and a network quickly, I think made it a tremendous, tremendous difference for us.
That's great. Well, Renee, I definitely want to get to you. As Dawn mentioned, the ESRD networks can be a tremendous unbiased resource for patients, even I think helping them identify what are the right questions to ask and having them navigate challenges that may come up in their dialysis clinic. Can you share a little bit more about what the network offers to patients and how patients can find you?
Yeah, absolutely. Well, the networks are contracted by CMS. So I guess in that respect, there's a little bias because we are driven by CMS's their goals. So we pursue the goals that CMS has. CMS is the Centers for Medicare and Medicaid Services. However, we are a contracting agency, and so we are very resourceful. We are looking for credible information in the community because CMS's goals are our goals too, and we have to meet these measures. So patients and families can find information. You can Google ESRD networks, and it will come up. You can look by your state, and that will help you to identify specifically your network. But if you get a hold of any network, they will direct you to the right place. So don't have any fear about that. The networks are there to ensure that there is quality improvement occurring in the dialysis facilities. And it's also there to ensure that the federal regulations are being followed. As an advocate for patients, the networks are there to assist with any difficulties you're having with your dialysis facility. So if you're not getting the answers that you want, if you're dissatisfied with the care that you're receiving, you can contact the networks and they can intervene. They can help you to understand the federal requirements. They can help you understand what your options are. They can help you just kind of talk through the issues you're having and help you decide how you want that pursued. You can be anonymous if you want to pursue a grievance. And the networks have obviously federal authority to investigate complaints, to hold facilities accountable. And we also work in conjunction with the state health departments to ensure that state regulations are followed. And the states are the folks who go in and do the inspections of facilities and cite facilities for violations. So we work in tandem to make sure that dialysis is safe, that the quality of care is held to a certain standard, and that patients are receiving, that their rights are protected, and that they're receiving the information that they need. So we do a lot of education, we do a lot of outreach, we do a lot of training and quality improvement activities with facilities. When patients contact us or family members contact us, we can direct them to resources. A number of staff members in the networks are connected and part of organizations like Home Dialyzers United and the American Kidney Fund. So we have a lot of information we can share, a lot of collective knowledge.
That's great. Thank you, Renee. I think you know, prior to coming to Outset, I actually led policy and advocacy over at the National Kidney Foundation. And I remember we put out a survey really trying to understand if patients were aware of the ESRD networks, aware of the grievance process. And you mentioned the ability that if you are having some challenges or concerns about activities going on in your facility or not getting the right quality of care for you, that you can even file a grievance anonymously. I think that that's just, it brings up an interesting point, because it can be so hard sometimes to raise your hand and say, hey, I have a complaint, or I wish something was different, right? That isn't working for me. How do you find, and this may go back to Lisa and Dawn, how do you find that bravery to come out and just be on camera, live and in person? Really, how did you find that bravery to kind of raise your hand and say, hey, this isn't working and it's got to change? And before you answer that, I'll apologize, because I know I'm completely off that script and I am putting everybody on the spot. So I have completely gone rogue here, and I apologize for that, but I know you guys can handle it. So
no, that's quite all right. I think it's a great question. When you're sitting in that dialysis chair, you feel like a victim. You're so I don't even know the word to describe it, but you're dependent. You're dependent on the staff, to come and facilitate your needs and to put you on the machine and to take you off. And sometimes things happen that you have questions about, or you don't think is the right thing. You may see them doing one thing for one patient and something else for another patient, and it doesn't look quite right. And you may have questions about that, and you're afraid to speak up because you're afraid you're going to get labeled as, the patient with the loud mouth or the one that's complaining. And your ESRD network is right there, where you can call anonymously and you can ask those questions and find out if this is the way that things are supposed to be run, if the standard of care is being followed. And if you're not satisfied with the care that you're receiving, you can call them, again, anonymously if you're nervous about retaliation or getting back to your center, which the ESRD network never does. But, if you're nervous about that, you can call anonymously and get your questions and concerns addressed. Or you can just be like me and just be bold and say, hey, I don't like what happened in my dialysis center, and I want to know if there's some way that we can go about rectifying this situation. So it takes something inside of you that says, you know what, hey, this is not acceptable, and I'm not going to stand for it for myself, and I'm not going to stand for it for the other patients either.
Thank you. That's so great. And right at the beginning of our opening session, our keynote speaker, Leslie Trigg, said, fortune favors the bold, right? I think exactly. that applies here, right?
That's
for
right.
sure.
That's right.
Lisa, how did you find your boldness?
I think it was because it was my child, my middle son, 38 years old now. But I really believe it was because he was my child. For me, I'm not as good an advocate for myself, ironically, as I am for him. But when you see your child there and you see them struggling, and when the kidney disease started with him, he was very, very ill and he could barely lift his head up, and he had really started to give up, and it was just really a difficult period of time. And it kind of put me back into that, mom high gear. Start asking questions. And the more questions I asked, I found the more questions that I had. And most of the staff, 99% of the staff were super patient with me. I'm sure there are some mornings at 5 a.m. they wished I had less questions. But that was what drove me, I think, was just that it was a family member. And I knew that if I didn't ask questions and I didn't learn, I couldn't understand this. And I knew that with all his other medical, complexities, he wasn't going to make it unless we could put all the pieces of the puzzle together and do it very quickly.
Nothing like a mama bear. Yes, for sure.
That's right.
When your child's in harm's way, I think I'm a mother too. It would absolutely bring out the boldest advocate in me for sure.
The grizzly.
Yeah, the grizzly. I love it. I'm going to switch gears a little bit here and talk a little bit more about the broader advocacy, the advocacy that I'm most familiar with and what I've been doing in this kidney care space for the last 16 years, which is really trying to advocate for policy change. What are some of the key policy challenges that you think are limiting patient access to home dialysis? If there's so much empowerment and so much just even pure comfort in being able to do dialysis at home, why do you think it's not as widely available? And I'm going to let everybody answer that, noting that Renee probably can't talk about policy, but maybe can talk a little bit about some of the challenges that the ESRD networks are trying to help overcome for patient access. But let me start with Lisa this time, and then we'll work our way back around.
So for patient access, I think it probably depends where you live. If you're rural, if you're close to a major medical center, I'm 35 minutes from Boston, 40 minutes from Boston, in the middle of the night. And that makes a huge difference. Where you live does matter. And Medicaid, state to state, there are federal guidelines, but then each state has their own rules. So there are different layers when it comes to, the broader policy. I would say for people who want to get involved in advocacy, reach out to different organized groups. And you can learn a lot about your individual state. You can learn a lot about federal advocacy, where you can put your voice in and how you can write letters or speak or do different types of advocacy. There's so much needed for advocacy around kidney disease right now and home dialyzing. And so many patients that I've run into have said, well, I was never even aware I could do dialysis at home. And like I said, I was fortunate. My son's nephrologist actually suggested it to us. So I think it depends on, there's so many things, clinician awareness as well. You can have a hospital that's in a major city that's getting very different information than a hospital that's out in a more rural community.
Yeah. Those great insights. Dawn, what are your thoughts?
Yeah, Lisa just said a couple of things that I advocate for as far as policy changes that really put a bee in my bonnet. Number one is access. It all depends on where you live. Certain neighborhoods get one thing and other neighborhoods get another thing. I'm from New York. I spend a lot of my time advocating in Brooklyn. I live in Queens. I'm from the hood, and I visited dialysis facilities all over the country, and I see the difference in the services that are being offered, the education that's being given. And, that's one of the things that I'm really advocating for policy change. I believe, and this is Dawn's opinion, but I believe there needs to be standardized patient education. Every patient that's diagnosed with kidney disease needs to receive the same education. It needs to be standardized so that we know that every patient is getting the same thing. And there needs to be a quiz or some type of a way to evaluate how much that patient has learned from that education so that we can gauge whether what we're doing is right or not. Another one of the things that I notice is that home dialysis is in all of the nice neighborhoods. And then when you go to the hood, there's not as many options available. So a lot of patients feel like, well, if it's not in my neighborhood, it must not be for me. And that's one of the reasons that they decide not to do a home therapy, because they can't get transportation over to the nice neighborhood so that they can go for training for 4 to 6 weeks or for 2 weeks to learn PD. So those are two of the big things. Another one of the things that's really important to me that we really need to be looking into as far as policy is concerned is we need those patient care technicians in the home dialysis programs. We're paying nurses, lots of money to do clinical care. And there are things that our patient care technicians can be doing to help patients get adjusted to being at home and to help them make that burden of home therapy a little bit easier. Patients get sick, they go to the hospital, their care partner's away for a couple of days, and our patient care technicians can really help our patients to continue their home therapies without having to go back in center or without considering stopping home therapies altogether. So I can go on with this all day, but I'll stop there. But there's a lot that needs to be done, and that's why I hardly sleep at night, and I'm advocating day after day to get people to listen to some of these really important policy issues that are necessary to keep patients home and to get them home in the first place.
And those lawmakers are listening. And so I'll give a good example of this, and it relates to something you've just asked for, which is your story about how there's lack of access to home dialysis in the hood. I love how you put that. Congressman Bobby Rush, who sadly will be retiring this year, actually wrote a letter asking, I think it was asking CMS why there was not greater access to home dialysis in his neighborhood that was predominantly Black. Everywhere he would go, he would see in-center dialysis clinics, but no home dialysis options. And he would say you'd see it in every strip mall and in his district. And not too long after writing that letter, he really put pen to paper and worked to author a bill that is circulating in Congress now called the Improving Home Dialysis Act. And it's HR 5426. And I'll double check and make sure I got that right, because I'm not sure I did. But it does allow for staff assisted home dialysis by patient care technicians, that if that were passed, more patients would have access to staff assist in the home by PCTs. It would also calls for greater education. So two of the things that you just ticked off, there are a couple members of Congress now really pushing that bill, with Bobby Rush leading the way to try to help improve home equity in access to home dialysis. And I will say here. Yeah, so that's your efforts are paying off. They're not for naught. And I did get that bill number right, HR 5426, if anyone wants to check it out.
Great.
Renee, so I know you can't advocate. You're under a government contract, so that's not something you can talk about. But can you share a little bit of the ways that the ESRD networks are trying to solve some of the access barriers to home dialysis? I know a lot of work has been done there.
Yeah, I can't say that we're having any success, really. There are a lot of challenges. There's a lot of logistical infrastructure issues. So we do have a huge goal that we need to meet, set by CMS by a presidential directive. I can't remember the exact terminology, but essentially that's what happened. And so there is a enormous push to get patients home. And it is a better quality of care as far as the person, nobody's going to take better care of you than yourself or your loved one. Right. So that's one thing. People just have better outcomes when they go home. It's definitely a more comfortable environment and it's familiar. You have more flexibility. You're not strapped to somebody else's schedule, and you don't, you can have whatever noises you want in your home or not, versus being in center where you're really, whatever's going on in the center, you're in the midst of it. So there have been issues with, I guess the first one that comes to mind is we don't have very many physicians that are trained to do home dialysis. So that is a big problem. It's not part of the many fellowship programs. And I do believe that they are trying to address that, but that's not going to happen tomorrow, right? So that's a big barrier, is not having enough physicians who can provide orders for home dialysis. Throughout healthcare and the service industry in general, there is an issue with staffing and turnover, the Great Resignation. So getting nurses and technicians or whoever's going to do the training, trained to do that training, there's a backlog with that. Trying to get that many patients into a program, get them trained and get them home, you've got to have staff that can accommodate that. So there's a big wait list for people to get moving on that. And people lose interest. They've heard about this, they've been pushed to get more information about it and to try it. And then there's a wait for them to try to get trained for it. So there's a lot at play that complicates it. Then, the networks are trying to assist facilities in developing peer support programs where people who do home dialysis and transplant and other options that are beneficial to talk with their peers who may not be interested or maybe on the fence about it, about the benefits that they've encountered with doing more independent treatment. And also care planning. We're really trying to help facilities to talk more with patients, have conversations differently with patients. Facility staff have goals they want to meet because they're required to meet them, but also because it's for the welfare of the patient. And so they have their agenda when they're developing care plans. Patients are supposed to be involved in those care plans. A lot of patients don't participate. They don't want anything to do with it. They're tired of dialysis. They're tired of being preached to, or whatever their perception is of the care and the paperwork that is involved in all that. But I have to encourage everybody to not let your care plan go without your input, because people are making decisions about your care, and they're going to make those decisions that are convenient for them and meet their agenda versus what's really important to you. And I think what's important mostly to express to facilities and staff is that, how is dialysis impacting your life? How has your life changed because of dialysis, positively or negatively? What are the goals that they're trying to meet that are important to you, and what goals they're trying to meet are not important to you? When they're proposing changes in your treatment, are you on board with that or not? Because if you're not on board with it, what is the likelihood you're going to follow that? And then, you may be perceived as non-compliant, non-adherent. So it's important that you have a conversation with your team about what your values are, what's important to you in your life, and how is dialysis impacting that? And when there are changes proposed to your care that you don't agree with, it may not be something the dialysis team is going to be willing to get on board with. For example, if you don't want to do dialysis 3 days a week, you want to do it 2 days a week, they are likely to say that's not in your best interest. We can't ethically prescribe that, but you can start a conversation about, well, what would it look like, to do something differently? I can't come here 3 times a week. Well, what could you do? Let's have a dialogue about that. So it really is about communication. It's about understanding the perspectives. It's also equally important that your perspective be a part of that. And by just sitting back and allowing, the paper to come to you that you sign off on, is, that's not the way to do it. That's passive participation, and you're not going to be happy with the outcome of that.
For sure. Dawn or Lisa, do you want to weigh in there on what Renee has laid out?
Yeah, I just want to say bravo, Renee. That's it's just it's the right thing to do. You have to stand up for yourself. Again, things that are important to you are not necessarily important to your care team or to your doctor specifically. They like to see numbers and they want to see them going down, or they want to see them at the levels that that work with the Quality Initiative program. And you know what? That might not be the best thing for you. That might not fit into your lifestyle. So, you have to make your needs and your family's needs and your life important. That's number one. For some people, longevity is important. They want to live to be 110 years old. For some people, that's not really all that important. What's important is I want to ride it till the wheels fall off for 5 good years, and so that has to be made clear to the people who are providing care to you, because that's how you make the adjustments that are necessary so that you can be happy from day to day. Hope is always present. It's us that have to reach up and grab that hope. And we have to make sure that the people who are caring for us understand what's important to us. And if they're not reaching out to make you a part of the care team or a part of the conversation, don't just sit back and suffer in silence and accept what's given to you. Stand up and say, listen, I'm a part of this discussion too. I want to be a part of this discussion. And if I'm not a part of this discussion, I know who to get a hold of so that I can be a part of this discussion.
Yeah, absolutely. Lisa, what about you?
I've absolutely used that line, Dawn. I know exactly who to call. A big piece, though, that resonates with me on this is you empower the patient to ask questions. I think standardizing the care from a federal and the state level is important. I think being able to empower patients and maybe even having, and we were talking about this in another session, I actually put a comment into David about, wouldn't it be nice to have a sheet of questions for somebody who is approaching stage 4 or stage 5 CKD?
Yeah. For the person who crashes into it, wouldn't it be nice to have some materials and questions that are kind of standard to start this conversation? But also there has to be some commitment, I feel, from CMS for education for clinicians, because without clinician education and without clinicians being prepared to answer these questions, that's the other side of this equation. And my hope is that more clinicians not only get the education, but the resources to be able to provide these options to their patients. Because I think when you have health inequity, patients can't always get those options met without, the things being put in place. One of the other big components of this is, the inequity, one of the biggest ones is poverty, because you have to have, a grounded outlet. You've got to have certain things. If you're living in an apartment in the inner city, you may not even be able to plug a home dialysis machine in safely. So there's a lot of different components that have to come into this. And I think it's empowering the patients, but it's also going to be a commitment from CMS to say, yes, we're going to work with providers, we're going to work with GME education, we're going to work with major medical centers to start to spread a lot of this information. Yeah, I think there's a common thread through everybody's discussion here that Noelle in the chat identified, which is at every step of the way, a good question to continuously ask are, what are my options? When you've told no, or you have to wait to do home dialysis training. The next follow-up question, what are my options, right? When you're trying to consider what modality is right for you or what treatment your kidney failure faced for the first time, what are my options? I think it speaks nicely to what Dory Chattel from MEI and Home Dialysis Central said earlier, right? I want the care plan designed around my needs and to be really help me live the life. I actually wrote it down, the life that you want to live, right? Not the life that you've been handed. And so that really gets to really continuously asking, what are my options, even when it feels like the door is slammed in your face. So that's really helpful. We are getting a couple of questions in the chat, and I please encourage others to raise the questions, or you're stuck with the ones I'm asking, and I don't know if I'm asking the right questions either. So please do chime in. But John says, I feel that we have more than a sufficient number of materials, and I think he's speaking to educational materials out there, and I've seen the plethora. I've been part of developing some of those materials myself. There's a lot out there. How do we get it into the hands of the patients? And Renee, maybe I'll pose that question to you first.
We've been struggling with that also. I mean, it really does come down to the dialysis facilities, the people handing off the materials, but not just that. I mean, there's health literacy involved in all this. So it's not just about handing a piece of paper to somebody and expecting them to read it and understand it. People learn differently. People have different reading comprehension skills. People have different places that they're at in any given time that allows them to intake information. So usually people get, when they start dialysis, all the information is handed to them like immediately as soon as they're starting. And that's no place to start educating somebody. Upstream, when they first get diagnosed or they're first being introduced to kidney issues, they should be getting information about what that means, what that can lead to, and how to prepare. It should be all part of the ongoing healthcare process, not just you're on dialysis and here's a stack of information for you to take home with you. It all goes in the garbage. Nobody goes through any of that. Some people are visual learners, that they can take the information in by reading, or some people are auditory, so they have to hear these things. Some people prefer to learn through video or research things themselves. It's on the shoulders of the provider to make sure that the information that's being provided to patients is something that, one, they're ready to have, that this is information that they want, because if they're not interested, they're not going to learn from it. So what is their interest level, and how important is it to them to have this information? Providing them with finding out how they want the information, if they prefer to see a video or they want to talk to another person who's going through this experience. These are all ways of helping to get the information into the hands of patients. Peer mentoring is a huge thing. I know that people often hear things, the same information that they got from a provider, they never hear until they hear it from a peer, right? There's just something about a peer talking to you about healthcare stuff that they've experienced it, and I don't know, there's just something maybe about the trust level, that goes into accepting information from certain sources. Because I always hear from providers, we have given them this information over and over and over and over and over again. And until they actually have a conversation with, one of their fellow peers, they never really got the message. Yeah. So it really is on the provider to make sure that patients have access to the information they need, and handing them a piece of paper. And I'm not trying to say that that's how we all do it, but it happens all the time. I hear about it all the time.
It's our default position. Let's create a pamphlet. And I can speak to that as when you work for a startup organization, which is what Outset was when I first started, you kind of flex your muscles in different area. And I was trying to help the marketing team develop a modality options brochure, right? And I was like, okay, there's a lot out there. Why are we doing this? Let's do it. I worked so hard on that brochure. And then we had a company meeting where David Rush got up on the stage, and one of the first things he said is, I don't want your pamphlet. That thing got, like, when I was diagnosed with PSRD, that pamphlet just got thrown in the back of my car and I never saw it again. Right. So I think your points on hearing it from peers, it resonates really well. I think, Virtual Center, I don't know who Virtual Center is, but that is their name in the chat over here, says that they have their MPH. I'm also have my MPH. And one of the things you do learn is that people not only need the literacy level at a 5th grade reading level if they're going to read that pamphlet at all, but they like to learn from people that look like them, that seem to be sharing the same experiences that they are. And I can say, as a mom, the first thing I did when I was pregnant is ask other moms, like, what was this experience like for you? That's where I wanted to go to get my information. I imagine it's very much the same for you all. But Lisa and Dawn, you wanted to chime in here on this topic of how do we get the information into the hands of patients? How do we get our message across about options?
Yeah, Renee said a lot about, how we get the information to patients, and it needs to be in a language that they understand. It needs to be in a format that they understand. But, as I look into, what I'm surrounded by in my community, and knowing that this is the digital age and a lot of things are electronic now, and, everybody doesn't have access to that. A lot of people don't have access to that. If I walk from the back of my house to the front of my house, I don't have Wi-Fi. So, you can't really depend on everything living on some website for patients to access to get information. It has to be delivered in different ways, like Renee said, but sometimes you just got to really get the boots on the ground and get out there into the streets or get into the community, get into the dialysis centers, and you got to sit down and take 15, 20, 40 minutes, however long it takes, and talk to people. We don't do that anymore. We text everything, we type everything, and we don't have conversation anymore. And that's where patient advocates really come into play. And, that's another thing that I really advocate for. We need to have our whole kidney community flooded with paid patient advocates that spend time in these dialysis centers, that are resources for the patients, where they can go chairside and talk to the patient while they're on the machine, if that's what the patient prefers. If they want to talk, bring in family members, the family members can talk to the patient if that's what they prefer. We can't just depend on these digital, sources of education and pamphlets that everybody's throwing in the trash. We just have to use more than one medium, and we have to be fair and equitable about the way that we're providing this education and this oh so necessary information, life-saving information.
I love what you said, and I love that you can really improve health equity in a couple ways, right? Having a patient advocate that looks like you, it has similar experiences like you, sit down and tell you that information may actually help with these challenges and gaps in access to equitable, home dialysis. So as one example. And then the other issue, which we can employ, right? Companies can employ patients that can be advocates and get that message across, right? Again, helping continue their ability to work in a gainfully employed situation. So I like you gave two solutions to the health equity challenge there. That's great.
Exactly.
Lisa, do you want to chime in here? And I know we're about 5 minutes out, but we'll close out this conversation with you and maybe have time for one more question.
Just quickly, I would echo everything that Dawn says. I think the person-to-person communication, and I think with, the cancer community, many other communities, cardiac community, they have advocates that you can ask to bring somebody to an appointment, or you can have somebody digitally sign in and be part of an appointment. Wouldn't it be nice if some of our kidney patients that needed support had access to advocates, or somebody to come be that second set of ears if they're all by themselves in clinic and they don't have a care partner? And that's a whole nother topic for the people that want to go home that need a care partner. How do we bridge that gap? So I would echo what Dawn said. I think we've gotten away from people talking to people. And one of the best things that's come out of a lot of the groups is a lot of people have taken the chat offline and been able to actually have a conversation with each other.
Yeah.
I know. Hi, Dawn.
Yeah. The digital divide here is resonating with our audience. There's a couple of really great comments in the chat here about the generational divide, right? So for our younger population, they actually may be more comfortable texting and chatting, but a geriatric population, as Kim points out here, really do feel underserved because they don't know how to use these resources, or they just don't want to use these resources. Maybe they like that person-to-person interaction and probably have missed it so much during the pandemic.
Those are great points. Again, it's just really important to be able to provide the patient what it is that they need in the way that they need it. And there's nothing like that experience that I have when I sit down next to a patient and they actually see my needle marks or they see my graft, and, I'm able to talk to them about my experience and, help them to make some decisions that they need to make. There's just nothing like that. And we just can't forget about those things.
Wow, very, very well said. Well, in our last couple of minutes here, what I want to do first is thank you guys for joining me on this discussion. You have been such amazing advocates for yourself, for others, for your child, Lisa, and it's so inspirational to hear from you. Renee, just your honest candor about we're doing everything we can think of, but we're still facing challenges getting patients to be able to have access to the information, participate in their care plan, yet it's so critically important to their outcomes. And with this last 2 minutes, I want to do a little bit of a lightning round with just one piece of advice, a quick piece of advice from each of you to the audience today. And you've got a good mix of patients, but you also have some clinicians in this audience too. So one last word imparting advice on this audience, and I'll start with Renee.
Yeah. I guess one thing that I wanted to make sure you knew about that I forgot to mention is that you can contact the network. You should be able to, if you don't have access to a computer, you can't Google or whatever. Your dialysis facility should have a information posted about who to contact when you have a concern or a grievance. And that should include their internal process, the network's information, and the state's information.
Great, thank you. Lisa?
Well, I think if I only had one piece of advice, ask questions. Ask questions of everyone. And there is no stupid question. And I can't say that enough, because even I've sat with questions and thought, this is not a great question. And it really was the question that led me to, resolving a problem. So ask a lot of questions.
Great. And Dawn, you get to close us out here.
Yeah. One thing I just like to say is advocacy starts with yourself. And just a piece of advice, if anyone wants to pursue being a patient advocate, one of the greatest places that you can start to get the training that you need is with your local ESRD network. Renee is at her network, and they're all over the country representing your specific area. and you can get the training that you need, and they'll give you the information, the resources that you need so that you can get out there and start speaking up for yourself and for others. So don't just sit down, speak up, stand up.
I love it. All right. Thank you guys again. I'm humbled and honored to have spent this hour with you all. Appreciate your participation and appreciate the audience's questions and interaction. Thank you all. Have a great day and enjoy the rest of the sessions.
Thank you.
Thank you.